Alright, so for the next drug before us, which we'll get to discuss, is pharmacology, is ceftizoxime. So pharmacology of ceftizoxime. Okay, so you could actually see the drug here. Okay, so for ceftizoxime, we said that's a third generation cephalosporin antibiotic. Okay, so it's known for having a broad spectrum of activity. That's like the microorganisms that this drug can be effective on. There are a lot of them. Okay, so mechanism of action is, it basically works by stopping the cell wall from being formed optimally. So the microorganism, that the bacteria, grows without an intact cell wall, so it's now predisposed it towards attacks that could actually break down the cell. It could ultimately even lead to the cell death. Okay, so ceftizoxime, we said that it is effective against a lot of microorganisms like Escherichia coli, Klebsiella pneumoniae, Proteus mirabilis, Haemophilus influenzae, Neisseria gonorrhea. Okay, and all of that. So they usually give it through the veins or the muscles. Okay, so it distributes well in body tissues and fluids. It goes to the respiratory tract, goes to the urinary tract, then goes to intra-abdominal site. Of course, for the places it can be able to go to, it can now be used to treat infections in those places. You understand? So it's used to treat infections like lower respiratory tract infections, urinary tract infections, skin and soft tissue infections, then intra-abdominal infections, then also gynecological infections, once it is caused by what this list of microorganisms that we actually listed out here, that it is actually effective against them.